Dr. Jaffe, what can you share about primary myelofibrosis? Can we use any of our PERQ supplements to help somebody to support a patient with this condition?
Well, primary myelofibrosis is a significant risk factor. It was actually as a syndrome defined by Alan Cohen. He was the head of the autoimmune rheumatology section at Boston University, my alma mater. And what myelofibrosis says is that the body is producing scar-like type 1 collagen in excess in places where you shouldn't be producing scar-like type 1 collagen, including in the bone marrow. So when we say myelofibrosis as a clinical laboratory pathologist, what that evokes in me is an awareness that you need your bone marrow to be producing white cells and red cells and blood platelets and a variety of other factors. You do not need extra ropes of type 1 scar-like collagen to the excessive degree that you can see it under the microscope if you do certain kinds of biopsies, but more importantly, it chokes off the necessary bone marrow producing cells, the megakaryocytes that produce the platelets and the precursors of red cells and white cells that are all essential. Now, in regard to what can dietary supplements do, you can be supportive of a person that has myelofibrosis. It's very important to distinguish that the individual who has myelofibrosis can still promote having enough antioxidants by doing a regular C cleanse and taking polyphenolics to go with that. People with myelofibrosis would benefit from being able to recycle some of this extra collagen scar-like protein, which means keeping their dendritic cells really topped up with ascorbate and other antioxidants, a full B complex, and the other essentials like magnesium and choline citrate based on first morning urine pH. And yes, very often these folks have issues with comfort and pain. And then when they get enough of the ascorbate and polyphenolics, but also other essentials that support liver function, such as Livagard, and mitochondrial function to enhance energy, activity, and functionality to detoxify medications or other environmental toxins that have induced the fibrotic problem to begin with. So you don't treat something for which there's not a drug indication and a study of adequate numbers of people over adequate times under certain controlled conditions, but you do support the health and well-being of people, and if they do better as human beings afflicted by myelofibrosis, then in that way we can be helpful. I will also mention the importance of hydration. Starting every meal with something wet and warm is something we recommend. Having easy to digest, assimilate, and eliminate foods, including lots of grasses and vegetables and fruits, but whole fruits. You're sweet enough as you are. You don't need to add sugar. Mushrooms and fungi turn out to be very helpful in stimulating immune defense and repair functions. So just include that in your diet and eat what you can digest, assimilate, and eliminate without immune burden, and then let your body repair itself. So that's a bit of a long answer, but I do have a PhD in connective tissue, collagen, elastin, biochemistry, and it gives me a chance to talk about it every once in a while. So thank you for the question.